Okay. Hello, everyone. Thank you so much for joining us here today. My name is Cynthia Ramnarius. I'm a managing editor with the digital communications team here at NYU Langone. And I'm very excited to have my guests here with us today to talk about a very important topic, which is the impact of COVID-19 and pandemic on the development of our children and adolescents and what we've seen and what we've experienced in our kids. So joined here today by Dr. Benard Dreyer. He is a developmental and behavioral pediatrician at Hassenfeld Children's Hospital at NYU Langone and director of the Division of Developmental and Behavioral Pediatrics at the NYU Grossman School of Medicine. Hi, Dr. Dreyer. Thanks for being here. Hi. And we also have Dr. Moriah Thomason, who is an associate professor of child and adolescent psychiatry and population health and a faculty member of the Neuroscience Institute at NYU Grossman School of Medicine. So hi, Dr. Thomason. Thank you for joining us as well. So I'm going to kick things off right here, jump right into it. You know, we've all been living in COVID land for the last 2 years now. I don't have to say this, it's changed everything. It's changed the way we socialize, the way we work, the way we parent. And for kids, I'm a parent myself, I think the effects have been equally, if not even more so, jarring. You know, they're wearing masks, there's Zoom school, there's social distancing with their friends and family. There's loss that they've experienced. And these all have the potential to impact the way that we learn about the world and manage relationships. And I really just wanted to kick this off by asking, you know, in your experience, what has been the biggest impact on child and adolescent development? I'm going to start with you, Dr. Thomason, who I know your expertise is in the younger folks. So what are you seeing or what have you seen over the last couple of years?
Yeah, well, like you said, a lot of our interest is in young families, including beginning during pregnancy. And so a lot of the work that we do is with infants and toddlers. And in those households, it's been so disruptive. I mean, especially during the stay in place orders. And the primary difference was children were at home and both primary caregivers, if it was a 2-parent household, were home and siblings were home. So that's a huge difference in terms of thinking about child development and the experiences that infant has and the multiplicity of caregivers that are involved in that infant's initial learning and emotional support infrastructure. The second thing that we know, which is an unfortunate observation and is the case, is that there's been a huge cost to mental health in our society. And so when you add a mental health toll across large swaths of a population, those impacts we know from developmental research are going to sort of be passed on to the child. So thinking a lot about the parent's mental health as the context of the child, I would say those are the 2 primary things that I see in very early life. It's the family unit in the home and co-located, and it's mental health of the parents.
So let me go ahead, Dr. Dreyer.
No, I think that exactly lays out the issues. On the positive side, I have often seen some positive effects of children spending a lot more time with their parents in early childhood. I've had parents who, especially with those children who have been somewhat language delayed, suddenly feel their language is now much more close to normal, and that their interactions with their children were very rich. So yes, it causes a lot of stress. And I completely agree that any mental health issues in the parents are going to impact the child who has no other avenue of experience. But on the other hand, for some parents and some kids, they've actually drawn closer together and have kind of appreciated each other even more than in usual times.
That's a positive. I like to see positive things coming out of this era. So thank you for that reminder that not everything has been bleak, and that we can make the best of what we're
Yeah.
going through right now. But let me ask you, I want to ask you about adolescents in particular. What are you seeing in terms of impact on social, emotional, mental health with adolescents?
Yeah, so I think adolescents in some ways have been more impacted than younger children because adolescence is a time when they're trying out peer relationships and they're figuring out how to relate to their peers and also how to move along the trajectory to becoming an independent adult. And so this lockdown, in essence, or just a virtual experience has been, I think, even harder on the adolescent. And we know that mental health issues in adolescents have increased during the pandemic. And I believe part of it is due to not being able to be with their peers and sort of they feel being locked down and sort of in the house much more so than younger children. They don't play with their toys. And actually, as an aside, the toys that they do play with are usually screens. And so their interactions with their peers and with the outside world have been very screen-based. And that has not been necessarily positive either. As we know, too much screen time, especially for adolescents, gives them somewhat distorted view of the world and of their own worth. And so I have seen with a number of adolescents, including my own grandchildren, that it's been hard for them to be kind of trapped without outside experiences, especially without those peer experiences.
Mm-hmm.
Yeah, and I would guess, Dr. Dreyer, that there's an element of reward processing where the external environment is rewarding in terms of peer navigation and being able to be stimulated by your peers. But if they're getting it through a technology, does that reward system feel satiated? Whereas we would prefer for them to seek those kinds of rewards through interpersonal interactions.
Mm-hmm.
I think that's a possibility, that there's that the reward system isn't calling or like pulling on them to have those same interactions because they're finding them in
Right.
this.
Yeah. I think that's absolutely true. And also one of my concerns, although I'm not sure there are studies that show this yet, but that some of these changed modes of communication will be long lasting. That they're now used to, not, rather than in-person relationships, to have Facebook or Twitter or Instagram or whatever kinds of relationships. And they've gotten some support from those relationships in this time, but they're now sort of okay about that being the mode, which is not something we want to encourage.
Yeah, no, that's fascinating. I have a 14-year-old son who, before the pandemic, I was very rigid about screen time and stuff. And then, the rules went out the window because what else are they going to do? But it was how he maintained connections with his friends. And now I see he'll have a great time gaming with his friends online, but he's struggling at school making friendships in person. Any tips on how parents can help, help their kids learn how to make friends and operate socially in person like that?
Yeah, I'm sure Dr. Thomason also has some things to suggest. What I would suggest to begin with is to speak to your kids. That's always a good thing to do, and see what they're feeling about the screen versus the in-person peer reactions, but then also help them problem solve as to how they can have more in-person reactions in a safe environment where and try to put some limits on the amount of screen time that they have at home.
Okay. You know what, Dr. Thomason, I want to turn this question around a little bit to you. Thinking about younger kids, my kids are older now, but what has there been an impact of the loss of, play dates when kids were younger, or even like the fact that, I don't know, that kids went through kindergarten all through Zoom, like things like that. Has there been an impact there, and how does that play out, and how can we help with that?
I'm kind of in the camp of optimism, because children are so incredibly adaptive. I mean, the human species is radically adaptive, and so and that little very young brain is learning so much through the primary caregivers. So as long as there's a steady routine and care is provided and care is there on a regular basis, then the needs of the child are being met. I don't have any reason to predict that child would experience any sort of lasting delay. I did want to actually, if okay, go back to the older.
Yeah, go ahead. Absolutely.
Because I do think, again, our little ones, I think, are kind of insulated, and if anything, I would predict better outcomes for them in this context. And I can elaborate on that if we get to that. But for advice for parents of the kids that are older, that are really in this social blossom, which Dr. Dreyer pointed out, such a calling for this developmental period. Another thing I think parents can do is be a good role model. So this is tricky, but it's a primary parenting practice that can be really valuable. So like if your kids are not necessarily having great social interactions in the school context, then model good social interactions by bringing your social world, and like give them some of those exposures. The second comment that I had, and just because it's separate from what was already discussed, which I agree with completely, talking to your kiddos. The second thing I wanted to bring up, Cynthia, with your example, with your male 14-year-old son in gaming, sex differences, like girls and boys in this context, the way that they're problem solving is very different. And I don't know that I don't think I have the way to sort of break that down. But I can say, being attentive to the fact that the needs of a female adolescent and the needs of a male adolescent are probably going to be met in somewhat different ways, and just making sure that you have that. And most parents have this intuition that not one size fits all. And so just kind of being mindful and of the identities that your child holds, whether it's a sex identity, gender identity, whatever identities your child holds, and like what the things are that are going to suit that child. Because I think of the gaming, my son too, he's so social in his use of gaming. It's radical. Yeah.
No, yes, absolutely. We could definitely understand each other here. But that is fascinating. I have a son and a daughter, and I couldn't agree more how much their needs are different. But I also love the advice of, like, as parents, it's not always about just telling kids what to do, but just modeling the behavior, like go out with your friends and have a good time, or have your friends over for coffee. Yeah. And just, show the importance of human connection. I really love that. I want to circle back to something that was said earlier about anxiety and parental anxiety. I think, we're seeing anxiety in kids so much across the spectrum. But I think it was you, Dr. Thomason, mentioned, our anxiety as parents. Can you talk a little bit about that? How does that then trickle down to kids, and how can we stop that, if possible?
Yeah. Well, with most things in life, you have to take care of yourself before you can take care of others. In the airplane, you're supposed to grab your oxygen first. And so how do I think that the solution is, it starts with yourself. Like, how are you getting your primary needs met? And becoming as whole as you can, because that's a big order, in that space is going to spill over to your child. And so if you're not having your own needs in your own emotional and social support, you're going to have a very hard time. So what can you do about your own is where I would answer this question. Like, how do you actually, and we don't really know, but our group did some research with moms during COVID and looked at coping behaviors. And so I took an inventory on the kinds of things that women were doing during the height of the lockdowns. These were pregnant and new mothers. And we did find that there were certain types of coping behaviors that were predictive of better mental health, which is promising because it suggests that the kinds of things that we engage in, the patterns that we fulfill in our day-to-day life can have mental health benefits. And overall, the best kind of coper in our paper, which recently has been accepted, so I can share it with the community soon, were those that what we called high copers. So they engaged in practices that were like self-soothing, like a bath or meditation or just caring for your body, sleep, but they also engaged in things like using social media more or even eating junk food, which sounds kind of crazy. They just were people that kind of sought out a lot of things that made them feel better. The ones that were less good were those that only sought out the things that we know traditionally are not good, like screens and comfort foods, or those that just were low copers overall, meaning they just didn't many coping activities. So I don't know, this isn't going to help all mental health or like fix all problems, but it is good to know that if you can find things in your life that are make you feel better, then that's not a small thing. That should be attended to and cultivated, and it should have a positive impact on your child.
Definitely. Dr. Dreyer, can you speak at all to how we're seeing anxiety affecting teens, kids? Is there a developmental impact of that?
Again, I don't know that we have studies that prove that that's the case, but clearly I see many adolescents whose parents bring them in because they are having anxiety. And so I suspect there is certainly, we know there's an increased incidence of both anxiety and depression in adolescents during the pandemic. So a part of the anxiety, anxiety is all over the place, right? But one area where I think we can give parents advice is anxiety over COVID. So a number of school-age kids and adolescents are very anxious about the COVID pandemic. What is this going to mean? Are they going to get sick? Probably even more importantly, are their parents going to get sick? Are their grandparents going to get very sick? They've seen a lot on TV or other media about older people dying in droves. And some, I actually, a number of the teenagers that I care for have had grandparents who've died. So it's not unreal. It is actually a real risk. So I think parents are sort of in the middle, in the middle of the sandwich between older adults who may be much more at risk and the teenagers who are worried a lot. And I think they need to negotiate making the teen personally feel that they're going to be okay. And most of the time that their parents are certainly going to be okay. And what this family can do to protect themselves, obviously including getting now triple vaccines, which I would hope every parent who's listening to this is going to go out and make sure that their 5 to 11-year-olds are vaccinated, and their teens, I think, are now going to be offered a third vaccine as well as all the adults in the family.
All right. Well, I'm going to go there then, Dr. Dreyer. You are our behavioral, you both are our behavioral experts, development experts. is there any risk to child development from the COVID-19 vaccine? Is there anything that could get stunted, affected, harmed even?
Yeah, so I get this question a lot from parents, actually from colleagues in the office. And certainly, as you know, I do a radio show and I get a lot of questions on the radio show. And the short answer is no. There is no risk to development. There's no risk acutely, and there's no evidence that there are any long-term impacts of the vaccine itself. The reverse is true for COVID. So we are now learning more and more about so-called long COVID, which does impact children as well as adults. And, NYU is now at the helm of a huge national study looking at this for both adults and children. And I've been involved in the child part. And so we're just beginning to get information and gather information on it. So we will know, but there is certainly some definite risk for some long-term effects of the COVID infection itself, but none for the vaccine.
Okay, great message. Thank you so much. I just want to say hello to everyone who's watching right now, and just remind you if you have a question, please jump in here, post below, and let us know what you're thinking and what you're wondering about. Just kind of continuing on this COVID track here, Dr. Thomason, can we talk about masking? I've heard a lot of concerns, especially from parents of younger kids, with masks, are affect. How do kids learn to read emotions and facial expressions when everyone's in a mask, or even language development? If you're not seeing a mouth move, how can you know? Is this unfounded? Is there any evidence of this? What's the research, and what's the thinking on this right now?
Yeah, Cynthia, that's a big question on a lot of people's minds, and I think has been on our minds for probably the past 18 months. Right. For the small answer is we don't have a lot of immediate research, meaning I know that there are many groups that are working on this question in the context of COVID, but those studies are not coming out right now, but I think imminently. If we look at past research, there are some examples we can draw from. We know, for example, that visible articulations of language help babies to acquire their language and social emotional skills. Right? So this idea that masking could be a hindrance. Yet we also know that if you look at the blind population of children, or you look at multi-language learner children, like those children don't end up having fallen behind, right? So I think that these children are probably going to learn differently, and that there may be some studies that measure differential either social, emotional, or language development in children that are exposed to masks, but I don't expect that to be something lasting. So just taking, for example, dual language learners, there was a period of time where folks thought that they were really delayed in their language development, but then later we learned that they were actually learning multiple languages to reference one thing. And so our systems of measuring their language development suggested one thing when in fact they built capacity in two things and well. So there's always this chance that at the time we measure something, there could be a mismatch, and we might see some of that. But I want to stop parents from being anxious, because I don't think we have any data to suggest these kids are going to end up in fundamentally a different place. And then also anecdotally, it's not just what the children are seeing in terms of that barrier of the articulation. It's also children are being masked themselves. So if we think about that side of thing, what would our predictions be? Maybe our predictions on that side of thing would be that the children are forced to make better articulations because you're shielding them, right? They have to work harder to be understood, and they also have to repeat themselves. So again, the literature is not out, but I think this is something that has to be explored. I think it's an important topic, but we could even see that the articulation of the children is actually pushing through the mask to make them stronger communicators.
So those are
That's interesting.
fascinating thoughts. I would just add two things. One positive, which is that at home, where young children are spending now during the pandemic most of their time, and they're learning most of their language from their parents or other caregivers in the home, nobody's wearing a mask. So the issue of mask is somewhat less of a either positive or negative factor for young children in the home. I think where that does perhaps impact them more would be in daycare or preschool. I think that's a positive thought. I think on the negative, I have some anecdotal reports from speech and language therapists. So I see lots of kids who have delays in language, and those kids have had some issues during the pandemic because they may not have in-person speech and language therapy, and virtual speech and language therapy is not necessarily as good. But in addition, even for those who are in in-person speech and language therapy, I've had those therapists say to me, I'm not sure I'm being as effective because I have to wear a mask. The child doesn't wear a mask, but I have to wear a mask, and that's the rules. And I'm not sure that I'm actually articulating as well, or the movements of my mouth are going to be as powerfully motivating to the child to pronounce words as such.
And that's interesting. You know, it sounds like a lot of what you're saying is just normal human interactions are what is so beneficial for these kids to see and experience, you know, in the home or in I guess what I'm saying is they're learning a lot more than we realize just by osmosis or just by in everyday life. You know, we're not always, even when we're not teaching them, we're teaching them, right? So that's really interesting. We only have a few minutes left here, so I just want to I'm going to throw this to both of you. Dr. Thomason, is there anything, you know, any I don't know, any hot topic on this topic that you just really wanted to address with parents today? You know, a reassuring word, or even just something like an aha, you know, type of moment that you just want parents to take away from this?
Yeah, sure. I think Dr. Dreyer and I have both hit on the positives, because I do think there's a lot of negative messaging out there, and it can cause a lot of anxiety to parents. And so, you know, hopefully that one of the takeaways from today is that children are highly adaptive. We're highly adaptive. There is a workaround to most of these things in life, and that children are going to be really well suited to find it. And in terms of like the things that we can be doing, certainly taking care of ourselves, certainly being good role models for our children. And then a final thing is just having routines. Like, this is a world where things are changing on a pretty constant basis. And we know that children thrive under conditions where predictability is high. So I guess my takeaway would be there's room for optimism, and there are some things we can do as parents, so we're not feeling like we're just totally lost and waiting for this to all unfold. And that's good news.
That is good news. That's wonderful news. How about you, Dr. Dreyer? Any takeaways?
I think from the point of view of the young children, I actually predicted that young children would have a lot of problem wearing a mask. But boy, was I wrong. They are champion mask wearers, and much better than I am, to be honest. And so that gets to Dr. Thomas's point about their resilience. They are extremely resilient, and it's just one more thing that they're doing. You know, it's not not necessarily a big thing, which often we as adults are interpreting as a big thing. So I think the resilience of children, especially young children, but I'm not trying to say adolescents are not resilient. They just have a more complicated life. And in some ways, the pandemic has interfered with their complicated life more than even for younger children. But
Right.
they will come out of this as well. And I think we just have to try to get back to normal as much as possible, especially for adolescents, but also for the rest of us.
Okay. And I do have to ask, like, you know, if you do have concerns as a parent, either developmental delays or just anxiety in your child, what can you do? Dr. Dreyer, I'll have you pick that up.
Okay, so I think speak to your pediatrician. If you want advice, if you have questions and you want advice, you should speak to your pediatrician first. And most pediatricians are doing this all the time and are pretty good at giving appropriate advice. The American Academy of Pediatrics has huge resources for parents to find on the web. Healthychildren.org is the place to go, or even the CDC website. So I would say go to your pediatrician if you have questions or concerns. Go to trusted websites. Don't just troll the blogosphere or internet, because who knows what I can tell you. I've recently looked at some things and it's like, wow. So, you know, which we know is the way it works. So go to trusted websites like healthychildren.org, speak to your pediatrician. And then if you think your child is really having problems, ask for a referral for one of these guys over here, either Dr. Thomason and Child and Adolescent Psychiatry, or Dr. Dreyer, representing Developmental Behavioral Pediatricians.
Awesome.
And I think that, yeah, I just think that's a small number. I think most kids, parents can get advice and manage the issues that they're seeing, either from their pediatrician or from trusted websites.
Okay. All right. Well, we are at time. I'm going to wrap this up here, and I'm going to put a plug in for our own website, which is NYULangone.org. If you're looking for a pediatrician to talk with any issues about your children with, we have lots. So thank you both incredibly very much. This is, I know, even I as a parent definitely learned a lot today. So we hope that we provided some great information for all of you watching right now. Visit the Hassenfeld Children's Hospital Facebook page on Facebook and like us to find out about future events. And again, thank you both so much. This has been fantastic. I really appreciate your time. So.
Pleasure to be here.
All right. Thank you so much. Goodbye.